good question is whether this is going to change management or practice in any way. How practical is it to measure postprandial triglycerides? I guess it's relatively practical. One could do it. I think we need more information to know exactly where this fits into the overall risk stratification of patients. What will we do with the information? Presumably, patients with coronary disease are already being optimally treated with aspirin and beta blockers, ACE inhibitors, and hopefully statin drugs to reduce the LDL cholesterol. Whether this is going to identify a target for treatment to treat the triglycerides is unclear. One can clearly reduce the postprandial triglycerides by by changing your diet. So your triglycerides will go up to a much higher level depending upon what that meal was preceding the postprandial increase. So it may identify people in whom one wants to really focus on some lifestyle issues, more exercise, more dietary control, as opposed to different pharmacological therapy. So it could kick into the armamentarium we use, but hopefully we're already having those discussions with our patients about diet and exercise. So I guess it could help in some patients who are reluctant to change if you have a number or something to identify for the patient that this is a bad post meal change in your triglycerides that identifies you as being a higher risk. So where it fits in is unclear, but you pointed out an interesting finding, and that is in diabetic patients this was less important, presumably because the diabetes in and of itself identified them as being higher risk, and this did not add any further incremental risk above what diabetes was already doing. But in the non-diabetic patients, this could be a factor. It could be a little extra fuel for the fire to convince people they need to do this, but I suspect that knowing how difficult it is to motivate people to change lifestyle, this may or may not be a factor. So we clearly have a lot of work to do to figure out the best way of communicating with all of our patients with coronary disease, the need to be dealing with the lifestyle issues that contribute to coronary disease and poor outcomes.